Jet set in Vietnam, a whole new type. I've been last unsatisfied by the new one fishy. Just away, just away, just away. Jet set in Vietnam.
All right, this is the Jetset Rehab Education podcast. Welcome.
Thank you.
I'm not going to use your real name. This is Catsby Famous. This is a cat influencer.
Cat influencer on TikTok.
She took our class. And
we have my husband, Daniel.
Daniel. This is Daniel. So, first of all, Daniel, how was your day? Because a lot of people want to know, should they bring their significant other on these courses? So,
yeah.
What'd you do today?
Relaxed, rode the bike everywhere, ate a nice relaxing lunch down at the beach, went for a little bit of a hike.
There's a lot of like stuff to do here, and there's bikes everywhere. It's kind of like those bird scooters, except for you don't have to pay.
Oh yeah.
You know? Yeah. Is this your first time in Vietnam?
First time in Vietnam,
First time?
yes.
All right. Last time?
Probably not.
Yeah.
Probably
you gonna come
not.
back?
Yeah.
And you've been traveling around Asia?
We went to Japan last year.
Yeah, we went to Japan.
Mm-hmm.
That was also for Jetset Rehab. We went to Japan last year, Tokyo area.
Yeah.
How does this compare, would you say?
This one's a lot more relaxed. The Tokyo life is very chaotic, but different and nice.
We're out in the sticks on this one. Like, there's probably no civilization, like,
For at least a couple of
and
miles.
By civilization, I mean, like,
Yeah,
the
definitely a
city.
little bit more
Yeah.
secluded, a lot more beachy, a lot more laid back. It's nice and relaxing.
Nice overall, yeah.
Each room has their own pool, which is pretty nice. We have a pool villas.
As somebody that doesn't take our courses, like, do you look forward to these things?
Yes. Every year, get to travel somewhere else, something different, little taste of something.
Yeah. Do you think it's better to go travel like before and finish with the class, or start with the
That's
class?
what we
and
have
then go
been
off?
doing, yes.
Yeah.
Yeah,
Get
It's
your
always like the
relaxing
nicest
in,
hotels, right?
Do the class, and go home.
Yeah.
Got it. And then you've been to quite a few,
Yes,
right?
this is
Name
my
all the ones
fourth
you've been
one.
to.
So my first one was Bali, and then we went to the Philippines, and then last year was Japan, and then this year Vietnam.
And what's your favorite out of all those?
Shoot, all of them are different. Bali was great. There was like monkeys everywhere. Bali kind of reminds me of Vietnam. Like, it's very like out, a lot of nature, a lot of forests, a lot of animals. Philippines was beautiful. Great, beautiful water. We were able to go out on the boat, go swimming, go kayaking, paddleboarding. Japan was different because it was like more like busy and crowded. It was just like a different environment, but there was like a lot more to do because like everything was just like right there, like all the shopping you wanted to do, all the food, a bunch of like different animal cafes, which is kind of cool. And then now we're in Vietnam. This is definitely a lot more secluded, a lot more laid back, relaxing, more like beach vibes. Beach. I don't know if I'd really say I have a favorite. Maybe Philippines. I feel like Philippines was pretty cool. If I had to choose out of the four.
I would say
too.
Bali. Like, I just like the hotel in Bali the best.
Yeah, the hotel was really cool.
They had like monkeys all around.
The monkeys were everywhere. They'd be like jumping on top
I
of
had
your
my
hut and
kids.
stuff like that, which was a little crazy, but it was cool.
Yeah. How about you, Daniel? What was your favorite out of all the ones?
So I've been to the Tokyo one and this one. They're both great, but they're completely different. I like the Tokyo one because there was a lot of things that I wanted to see and I was actually able to get done. But this one is not bad also. It's just more relaxing.
Yeah. You're not going to be like,
I
let me
was
get my
doing
shopping done.
I was doing something all day, every day out the other one.
Yeah.
So it's nice to have the options.
And what about the class?
The class is great. Claire is an amazing instructor. Even though this is my fourth time taking her classes, I feel like I always learn something new.
Same.
It just, I feel like it like opens my mind to like all the different perspectives, making sure you're looking at the entire person, just like different techniques that I can use back on my patients when I do get back home to the States. So it's a very good experience.
Got it. And then tell everyone where to reach you if they want to see some of your cat influence.
So go to TikTok. I use TikTok a lot more. Cats Be Famous. So I have 3 cats. I have Philip, who's the Maine Coon, Asha, who's a tortoiseshell, and then Lexi, who's my little gray and white kitty. So cats be famous.
Got it. Favorite cat product?
The cat
Yeah.
trees.
Cat
Like all
trees?
my cats
Okay.
love the cat trees. So that's if you have a cat, get them a cat tree.
Daniel? Are you also a cat tree?
My favorite thing would be the cat wheel, but they don't use it.
Yeah, we do have a cat wheel, but that's a work in
If
progress.
they used it, though, that would be the best.
Yes.
It's just hanging out in our family room right
And
now.
automatic litter boxes.
At least the one that we got wasn't the greatest. Like I don't know. We got some stainless steel litter boxes. We like those ones better.
All right, cool.
Yes.
All right, well, let's go find someone else to be on
All
this
right,
pod.
let's go.
Yeah,
Let's go find Chrissy.
yeah.
We're gonna
Can I
go.
find Chrissy, and then we got to get Claire. Claire brought a cat back from the dead, so I would like to get that
Oh yeah, for sure.
story on this podcast as well. Yeah.
We're gonna go find Claire and Chrissy then.
All right.
Thank you for
I'll be
having us.
here. Yeah. You can see here, we're at we're on the beach. You know, let me see if I can lift up the camera a little higher. You know, we're on the beach right here. It's kind of like a rooftop bar, I guess I would say. And then we have the happy hour here behind me. So we're sending Chrissy over here. Yeah, hop on, both of you. Yeah, you want? Yeah.
Ready? Scoot.
Yeah. Go ahead.
Here we go.
What is your karaoke song?
I don't karaoke.
I have no idea.
I don't know Madonna
Mine's
earlier.
Kokomo.
Kokomo?
Yeah,
Oh,
Kokomo,
we
yeah.
sang Madonna earlier.
Oh, which one?
In the bathroom. No, you weren't singing a
What'd you sing in
virgin.
the bathroom?
Like a
Yeah.
virgin.
Kidding. I don't know. What was it? What was
I don't remember.
I don't remember either.
We start singing to random
Oh,
things.
I
Okay.
just know verses. That's
There's
it.
been a
Yeah.
couple noise complaints coming from your room. I
We
hear.
blame
must
the
be
other
her.
Filipinos.
It's her, not me.
It's the cat.
It's a cat.
And it's Allison and Daniel.
And,
Yeah.
Allison. Yeah,
Yeah.
We'll blame it on
Introduce
her.
yourselves to the people out here. I'm like jet lagged. I think it's ready. I'm like
I think you
gonna
need more
fall.
drinks.
Oh,
Or get an espresso
Or
martini.
less. Oh,
the coconut.
no more coffee.
The coconut.
Yes, more.
The
that
coffee here in
Vietnamese-
Vietnam, I was saying the ratio is 1 Vietnamese coffee equals 3 American coffees. They're powerful.
We've been drinking like 3 a day.
Really? So you're
Yes.
drinking 9 coffees a day, basically.
Hey, it's kept us going though.
I don't think the coconut, Vietnamese coconut coffee is as strong as the.
I had the jitters, and I
Oh,
drink.
you did
I'm
you?
like a 2-cup a day.
Well, we've
person
been here
normal,
for
yeah.
over a week, so we've been drinking lots of coffee. I think
Super
we're
de-
adjusted to the
desensitized,
coffee.
right?
Yeah. Ooh,
And happy
there's
water.
a dong.
Oh, we got our next guest. in the
Oh,
week.
next
Yes.
guest. Next guest.
Well, introduce yourselves to the show. So
I'm
people know.
Glory Jean. I'm a physical therapy assistant for Kaiser North Valley at the Point West office. I primarily work with the general population. A lot of ortho. Some of the neurotherapists will send me some neurotherapists. A lot of balance stuff. So, yeah.
I'm Chrissy. I'm a PT, and I'll be at Sutter Roseville in the hybrid virtual program soon.
Yeah, you got a big career change coming up for you.
Yes.
Yeah.
Yeah. So, what are your initial thoughts? Just taking. I know this is your first.
This
and
is
this
my
is like
first.
your fourth,
Fifth. Ooh,
oh my
yeah,
God.
fifth.
By the way, we appreciate like somebody that's taken 5 of our courses. I mean, we appreciate it so much. I mean,
And I
you
think
keep
I've
our
brought a
company going.
total of like 6 people.
I
brought 'em in.
The sixth person.
Yeah,
You're number
she's the
6.
sixth.
All right.
I'm
Yeah.
number
They keep
6.
getting better and better.
Yeah.
You know, no offense to
Yeah.
the first 5, but
So
yeah.
hopefully I'll end up with some of my PT friends and
Yeah.
some PT assistant friends come out. The course is great.
Come on, PTAs.
Yeah.
We're gonna actually do some PTA-centric courses. In
Oh,
2027,
good.
so
Oh
Good.
yeah,
tuned for
I
that.
like it.
Yeah,
I
they have-
like it.
They have some new APTA certifications for
Wonderful.
PTAs coming up, and
Okay.
we're gonna try to be a part of
I
that.
think the PTAs
Okay.
don't get enough credit because they have to MacGyver so much. They have to keep track of how, like, so many different PTs treat and the things that come their
Oh
way.
yeah, I've done their
Yeah.
job before when somebody called out sick.
Yeah,
and they're
exactly.
Just, yeah,
Yes.
and I'm like, I don't like this.
Yeah, and they do it every
So,
single day.
congratulations, Steve. Good job.
Thank you, thank you.
I'm just
yeah.
assuming you do a good job.
Oh, thank you.
She
thank
does.
You.
She does a
Thank
wonderful
you.
job.
Yeah, thank you. Yeah, definitely. Working with a big clinic, I see a lot of various style when it comes to PT treatment. So yeah, any classes, especially jet setters, to be able to supply any physical therapy assistant courses to just assist us in managing some of the therapist's way of application when it comes to their treatment. So, yeah, I appreciate this class itself. It's a good reminder of us to just visually assess, not necessarily assess for us, but just kind of see and work with the therapist himself to just kind of guide each patient to a better outcome.
Yeah, I mean, Clare Frank's a great.
She is. Yeah, this is my
Absolutely.
first time working with her, so I appreciate because she has a background in neuro, so of course I work with neuro and ortho, so it's a great combination for me as a physical therapy assistant to be able to use that skill in the clinic.
Chrissy, can you name all 5 jet set courses that you've been?
Oh, okay. I thought it was going to be an anatomy question.
Rotator cuff.
So
Name
the
all.
first was Phuket, Thailand, which, as you know, had the best views. And then we did Bali, Philippines, Boracay, Philippines, Japan, and now Vietnam.
Oh, nice.
And your favorite? What's your favorite?
Favorite.
Yeah.
I mean, I don't think anyone would disagree that the Phuket, Thailand one was amazing.
Really?
At least the
Okay,
view.
yeah.
Being able, I mean,
The
you
classroom,
can't beat
the
the
view,
view.
yeah.
Beat the view. So,
They did film a rom-com. Have you seen that rom-com that they
no.
Oh, I gotta send it to you in an email. There's on Netflix. There's a rom-com where they filmed at that hotel. And,
okay.
Our classroom, they turned it into a wedding dress store
Oh, cool.
because like she got married in the movie. Yeah.
I think the class location itself,
Yeah.
Phuket, had just personally love being able the
That's your
chance to
fav-
go to Boracay in the Philippines, and then
yep.
I think the most fun that I've had is the adventurous trip we just took here in Vietnam, the motorbike tour. So just having those opportunities
Yes.
is wonderful.
Yes.
Yeah.
Especially being in Vietnam, first time. So it's
First time in Vietnam.
First
Yeah.
time in Vietnam. So
What are your thoughts because you haven't taken a jet set course before? What do you think?
it's great.
Yeah.
Everyone should be able to take one of these destination physical therapy any courses. Why not? That's
Yeah, why
great.
not?
It's yeah.
I
And-
always appreciate the fact that you can keep your skills sharp. We're not reinventing necessarily the wheel or keeping you in one certain style of physical therapy, but it's making sure your critical thinking skills stay intact. Yeah.
Yes. I agree.
Well, thank especially you for taking so many of our courses. I
Yes.
mean, that's you're a VIP. You're a Jet Set legend. You're going in the Jet Set Hall of Fame. For
Yay.
Sure. And then you're Rookie of the Year.
I am the rookie
yeah.
of the year. Yes.
Yeah. Thank you to both of you. And then who should be on this? Who's in the hot seat next?
Ooh.
Oh.
Yeah.
Mike
Close they are. Very close in the chair. Legs are touching.
Is my mic is live?
Yeah.
Okay.
You're live. You're
Hello.
live. All right. Scoot in a little bit, Jay, because
All right.
yeah, there you go. Now you're on it.
Hello.
Brian, I told you we're gonna get close.
Yeah. So, Brian, you're also a Jet Set legend. You've taken several. What's your favorite one so far? Take a Jet Set course.
Man, I would say the most memorable would be the first one we did, or first one I signed up for, which was Cabo. Just again, I think just the views were so nice and just the environment of it. I think that really was memorable for me. I would say Kyoto was another good one. That's one of my favorite cities.
That was a super cool one, right?
Yeah, I enjoyed that one a lot. The hotel was really nice.
And you got a free Jet Set hat.
Oh, the hat. Yeah, I still have it. Yeah.
Cool.
Actually, when I was traveling in Japan with the hat, people were like, "Oh, where'd you get that hat?" They were like commenting on it. Oh, Jetto Seto.
Yeah.
Yeah.
Yeah. You know, I have a. He actually attended the course. My friend Kentaro. Met him through Claire. He saw the logo and he was chuckling. He's like, oh yeah, Jetto Seto. He saw it says Jetto Seto, and he was just laughing. We're gonna see him coming up. He's taking the Shacklock course with us.
Oh, nice.
Yeah, we've got a little Japanese contingent now. We're starting to develop who like to take some of our courses and stuff. So it's kind
Wow.
of cool.
Yeah, we will be in Tokyo next week.
Right.
So
Michael
yeah,
Shacklock,
we're trying to
Neurodynamics.
be more efficient on our Asia trips. Do little 2-for-1s, you know.
Nice.
Yeah. And then so you've been Cabo, and like not a lot of people that did the Cabo actually did the double Asian ones too. So that's pretty cool. What do you think about this is the first one you've taken with Claire, I want to say?
Yeah, I've known Claire for over 10 years, and I was telling Jay, I forgot a lot of this basic stuff. I did the movement links course, I did residency and fellowship, but
I remember.
now doing home health, I just don't get to really use a lot of this stuff, so it's a good refresher. And it's like a throwback to the good old days.
I remember meeting
Back when
you
you were an
actually
outpatient,
at Movement Links. Remember?
That was my first memory of you, and this was pre-Kaiser, and I remember like you were one of our assistants, you, David, and I met a lot of people during that course, and I remember that.
I remember you were asking about the residency and the fellowship, and we had a conversation way back then.
Yeah, that's what got me into residency through that course. So
This is a great mix. This class is a great mix because we have PTs, home health, inpatient.
Right.
Yeah, it's really diverse as far as what everyone does, but I think Claire's doing a great job of making it relevant for everybody. She's like, this is a test how to integrate it into inpatient. Right?
Exactly.
Yeah. I mean, I think a lot of this material is very digestible, and you can use it based upon the person you have in front of you, your patient. And it's a lot of like Michael says this a lot in his cases. It's like it's an N of one, right? It's always the person in front of you. Like you can get tons of literature which says this is probably the best thing to do. But sometimes you can have an N of one in front of you, and it's not the most pertinent thing that you're going to do.
That's
so
right.
you have to modify it and deal with whoever's in front of you and do what's best for them.
Yeah.
And really try and manage the care that way. So
Yeah.
All right, well, Brian, thank you very much.
Thanks for having me.
Yeah,
Appreciate it.
You've met the trifecta. 2 different continents, and hopefully next year we get the 3rd continent. I don't know, maybe South America, Europe, something like that.
Yeah,
right?
we'll have to figure it out.
We'll
Looking
figure
forward
it out.
to it.
A lot of fun coming.
Yeah. If you're seeing this in 2027, go to our website and check it out.
Yep.
There's going to be some good classes for you up there.
Right.
Yeah.
Awesome.
For sure.
Thank you.
All right.
Thanks,
Thank you.
Thank you.
Appreciate it. Just hanging out over there in the corner, and we got the great Clare Frank coming on.
Sit here.
Yeah.
Just because of Mike's.
What's up, Claire? Here's your mic.
All right.
Yeah. All right. There you go. All right, you're on.
Okay.
So, welcome. This is the 4th one you've taught for us. I wouldn't say 4th or 5th.
I think fifth.
5th.
I think it's 5th.
I'm horrible at this. I've got every single person that's been on this podcast. I'm like, this is your 3rd one. It's like,
Yeah.
I'm getting everyone wrong. Man, I can't believe it's been. It feels like just last year you were like saying you wouldn't teach for us. Anyways,
it is a pleasure to come with you guys because it's not just a instructional. It's actually building relationships. And so one of the big keys is like just getting to know people on a personal basis rather than just hi and bye.
Yeah, that's a big thing for us, just because a lot of times you leave the class, you never really get to talk to those people again, and I think physical therapy in general doesn't have a lot of good networking stuff going on.
So you guys have a good thing going.
Yeah. Well, out of all the 5 courses that you've done, do you have any favorites?
Well, I would say as far as the ambience, this is spectacular. This being in a villa,
The property here,
property area.
We're at the Bayon Tree in Da Nang, Vietnam.
Yeah.
I've never been at a more beautiful property.
So you have the mountains on one side and beach on the other side. What more can you ask for?
Right.
Yeah.
It's got feels of Bali, feels of Phuket.
Yes.
It kind of brings it all in.
Yeah.
And I know we're going to go and travel a little and see Hoi An.
That's right.
And Hue. I hope I'm saying that right. But yeah, we're going to go see some of these places. So
We're all 3 of us are torn together. Yeah.
So that's going to be fun. Looking forward to that.
And I get to see you guys
I know. It's like a retreat.
Extended period
Yes.
of time rather than just hi bye in passing.
Right.
Exactly. Yeah, we're gonna get some good food, good times. Yeah.
Memories.
So I wanna branch out for a second. You're like, to me, I mean, again, you've been my mentor for a long time. Someone I've always looked up to clinically, and just as a person. Clinically, where are you at? Because you're always learning something different. And again, there were slides in the class today where I was like, oh, I didn't think about that. And like, you're always adding like new material. What's piqued your interest of late? You know?
I'm finding one of my strengths is I take many classes. I still take classes, and I try it out, and then try to integrate to what I call it an overall framework. And from there, when I say play, I don't mean play. I mean I try it and see how it fits into my framework and see if it works. On patients, of course, make sure it's safe, yeah? And then I will repeat the procedure over and over again and see what the benefits are, who it works for, and who doesn't work for. And so this is how I pick and choose now. So the tools become a little bit more specific. Initially, when I'm learning something, I would just use that tool over and over again to see for what, for whom, and for what purpose.
Right. The strengths and weaknesses of that particular thing.
Yeah.
Right.
And as far as I think you guys know my bent, I've always been more bent towards the soft tissue. So this is where I will integrate the soft tissue with how I train. Whether I'm unloading tissue or putting it under tension or load, but weaving that in soft tissue with loading. To me, I think this is where we need to start loading tissue pretty early on. And that's where I'm really into isometrics. Those of you who know me, I love isometrics. I have no problems putting isometrics on very early, provided that it doesn't create more pain. Because every day that you're in rehab, every day you're hurting is every day you're losing muscle or strength.
Yes.
Is that true?
Right.
Yeah?
Yeah. Yep.
So when I say muscle, I don't just mean muscle. It could be fascia, because when fascia or soft tissue is not loaded, then it's not doing its thing.
Right.
It's supposed to do. And you need the soft tissue to support the bones, the joints. So when I do loading, I'm not just thinking of loading the soft tissue, I'm loading bones as well. So this is Wolff's Law. So I'm always thinking, how am I going to redistribute the stress on the tissue, whether it's bone, cartilage, or ligaments or whatever? How do I load them, redistribute them as much as I can, and then introduce the load to create tension or compression, and more specifically, the direction of the load.
Yeah, I noticed today you did that a little bit with, you were talking about, you're like, this is a quad set, and you're working actually on thoracic rotation.
Correct.
And I was like, to me that was like, wait, and then I had to feel it.
Yep.
Right? I was like, wait, what are you talking about? And then I had to feel it, and I'm like, oh my God, yes, this makes sense. But I mean, it doesn't make sense totally to me. I still have to wrap my head around it, but it was like, there's definitely a new piece of information that I haven't.
So because how my brain works is because if you look at the slings and chains, I'm actually connecting like upper extremity or the spine all the way to the foot. And I know because we all walk, so those forces will be translated throughout. So if I'm doing something, a rotation, if I just load the opposite leg, that provides me that stability to create that movement.
Higher up.
Yeah, higher up.
Wow. Okay.
It's pretty fun. That way you're not so stuck in just doing straight rotational, unilateral PAs or whatever to your spine. I
don't know a therapist out there that I've ever met who would think, I'm going to do a quad set in this position to get thoracic rotation, that they're going to think that way. But I mean, again, if there's anything I've learned from you over the years, it's everything's interconnected.
Yeah.
There's a global reason for for managing. There can be a global way of treating to help mitigate or manage a patient's issues.
So I tell you, Jay, this is like actually applying these principles on patients. So I will tell a patient, look, I know you're having difficulty doing this. Let's give this a shot. Let's see if it works for you.
Right.
And that's how I learned. It's like I do this, it's like, oh, this person got much more.
I was going to ask what your system was.
And then another patient, I'll do the same thing. It doesn't work. And then I'm scratching my head. Why didn't it work? Was there a restriction that was that need to be mobilized first before I train?
You did it, right?
Yeah. So you start seeing patterns. So that's why a tool is only good if you can use a tool specifically for what condition, for who the patient is, who the person is. Because some patients, even though it works for them, they don't buy it.
So let me ask you, so let's go back to that thoracic rotation piece and the isometric. Is it neurogenic? Is it motor cortex? I mean, what are you working on to create that rotation?
I'm always thinking of tensional lines.
Okay. So more
Tensegrity,
slings and chains. Okay, got
and so, of course, when you do slings and chains, you're also affecting neurophysiologically.
Got it. Okay.
It's like going through the side gate or side door to
Yeah.
get to that movement.
Right. Okay.
And there are many ways you can play with it. Like I showed in class today, I can use eye movement to increase movement.
Yeah.
Yeah, that was. I hadn't heard that in
I can use
any
my
of your
tongue
lectures
to
before.
go into, because an oral facial is integrated into the entire body system as well. We forget the face.
Yeah,
So-
you brought up even the comment on you're like Jordan and I think you said LeBron.
LeBron and I feel this.
Well, anybody that's like trying to push something, they always have like a grimace. They're like,
Yeah.
you know.
They're using facial muscles to assist with the motion. Pretty funny. So pay attention next time you
Or is
read a
that creating
paper.
fascia tension to get more leverage, or is it
The top
actually
movement.
helping with the
I
movement?
mean, look, when you want to put a lot of force, don't you also like use your, like look at me? I'm
Yeah.
Yeah.
You're using
Like this
all
is
that.
my face.
Yeah.
Right.
So oral facial system is integrated into the entire
Yeah.
system.
Oh.
So it gives you more options. I think this is where I feel like it gives us. I mean, if you understand the slings and chains and the how things are connected, it gives you and I many more options
Right.
for treatment. Huh?
Yeah.
It makes it so much more exciting.
You know, but I'll be honest. I think you've been practicing for so long,
Yeah.
right? And so you're like transcended all the basic stuff, and you're like on another plane.
But I still
right?
go back
You're
to
like,
the basics.
You're like Doctor Strange in the Marvel
right.
universe. You know, you're like doing all this stuff like the mystical realm. That's where you're at. You know, I mean, that's the way I see you. You're just like,
It's rare. You have a rare.
yeah.
I don't know if I want to call it a gift or a rare work ethic or a rare system, but
I
it's
don't
working.
think it's a
I've
gift.
seen you with patients. It
I
works.
always say
yeah.
is I've done so many reps into it.
Yeah.
So I want to say I heard this podcast or read it. If you say it's a gift, then it gives other people an excuse not to work hard.
Yeah, that's true.
Do you know what I mean?
Yeah.
I work hard. I
Yeah.
want to say I work hard. I'm not the special gifted person.
You have like you utilize your system very well,
Yeah, I try
and
to.
you're always modifying your practice.
And I tell folks, if you want to be consistent, to be good, you first have to have a structure. A lot of folks want to cut corners.
Yeah.
They want to find the
yeah.
latest tool to work. Go back to the basics
Right.
and master the basics. And when you do a test, make it consistently, and it's like make that test, do the test well, so you eliminate operator error. It's I know it's so simple, but I see it all the time in the clinic. If you set up badly, your outcome is not so good.
Right.
Yeah.
Right.
And Shirley would always say that.
Yeah.
Shirley Sarman
That's
will always say that too.
big influencer.
Yeah, I should say you do the same test on every patient, and then you're going to start to be able to recognize the patterns.
Right.
Yeah.
So,
Cool.
so it's fun. I mean, it's like,
I was wondering if, to close out the podcast, if you could tell that story about how you brought a cat back from
oh
the dead.
my gosh.
There's been a couple of requests.
There you go.
Couple of
And,
requests. Okay, my cat basically, he was pretty young. This is a really weird story.
Yeah, I love it though.
He was dying basically. It was during COVID. So my daughter took him to the vet and they wanted to do imaging, which was a lot of money already. So we did the testing and they said, well, some kind of obstruction. They didn't know what it was. So they said, we have to do more tests, like a laparoscopics, whatever. And it's like and that costs another how many $1,000. And then if there's something there, then they have to do surgery. So that whole bill would have been about, what, 7 to 10K.
Yeah, and that's when you start thinking, maybe I'm not going to bring this cat back.
So my daughter and I, we were really distraught. And this was COVID times where I didn't have any income coming and she didn't have any income coming. So I'm like, you know what? Let's see what we can do. So I first started with vagus nerve to help him calm down because this cat was not eating. He was just in misery. So I started to do, and I didn't know where the vagus nerve was in the cat. So out came the anatomy book, or not anatomy. My anatomy was human anatomy.
Right.
So I asked my daughter to go Google where the vagus nerve in a cat. So she had the what you call it, the computer, the laptop open, and I'm following it. So I was doing this vagal massage on the cat. The cat calmed down, but it didn't solve the problem. He just calmed down. Then I was like, okay, I'm gonna do. Those of you who know what Voita is, I did some Voita points on him. So I started to activate, and then of course I had to go look for his ribs. So in a cat, it's different from a human. Once again, keep checking with the anatomy, and then finally, it's like I heard some gurgling when I did the Voita points. But then it's like, because when you do the Voita points, you're actually stimulating the breath work. So which means the diaphragm is actually causing the pressure. I heard peristalsis. Okay. Then I went further. I went and did visceral mobilization. So I started to do visceral mobilization as best as I remembered on a human. And this cat, I kept doing it, he kept farting. Okay.
Oh no! Wow.
Good signs.
Good signs. Gas is coming out. And so we'll start doing it more and more. And then I'll tell you, that cat came to life. I don't know what happened. The next day, he was back. He was back.
There you have it.
Wow.
Something was stuck up there through peristalsis, through visceral mobilization. And there you go. It was insane.
That's
I was like,
crazy. If people are watching this, you're going to get a bunch of emails my cat's not doing good. Yeah,
exactly.
So,
Well, especially
anyways.
with Elson on this podcast.
I mean, there's a lot of cat influencers watching this
That's
episode.
right. So
Yeah,
it was, yeah. So that was my story with my cat.
it's one of my favorite stories that I've ever heard you tell. I don't know why.
It's like, I don't know if
Yeah.
my daughter and I knew what we were doing, but just based on human anatomy, cat anatomy, we did what we could.
You have your system works interspecies, you know?
I don't know about that, but I was like, yeah.
All right. Adios.
Good night, guys.
So, yeah, tell everyone what your name is.
Hey, I'm Anne I'm a PTA. I work at Kaiser. I do both inpatient and outpatient. So, yeah.
And as we were just saying before, we're glad to start getting some PTAs in this. We're going to do some PTA-centric courses in the future
perfect.
coming up next year. So
Nice.
First Jetset course. Like, a lot of the people in the class, they've taken like 5, 3, 4.
Yeah.
As your first class, what's your impressions after day one, and what do you think?
So this is the second class I've ever taken with Jetset Rehab
What was the first one?
It was in, let's see, it was in Honolulu
Oh
or
yeah,
Oahu.
that's right.
Right. Probably like 3 or 4 years ago.
Mm-hmm.
And I remember that was a great class. It was pretty busy. Yeah, definitely a lot of people at that one. And then it's been a couple years since
At the
I came here.
Hyatt Centric Waikiki,
Yeah, that's right. Yeah.
That's
Yep.
a great hotel,
Yeah,
right? Yeah.
it's so, I mean, a perfect location over there. Yeah.
right.
And then here, this place is so beautiful. It's
Yeah.
like, I think it's probably the nicest resort that we've been at, like, ever. So it's just,
I think
yeah,
same here.
right?
Yeah, just the property, right? I mean, I can't
Yeah.
even believe my eyes.
And then the service and everything's just like so detailed.
You
here.
can't hear like any cars or any airplanes.
Nothing.
There's no. It just feels like you're in the jungle and then at the beach with no
For sure.
external noise except for the foghorn sometimes. Yeah.
Yeah. And then you can pick
Whatever.
up the phone and order a cocktail too if you want
Yeah,
to.
you're right. Well, thank you very much for being
Yeah.
a two-time jet setter.
Yeah.
And then hopefully we see you in the
yeah,
future.
I look forward
Yeah.
to doing more. I heard that you're also going to be doing more locally in the States, right? So that would
Mm-hmm. Hopefully,
be,
yeah.
yeah,
2027, we're going to be all over the place. There's
Perfect.
going to be a lot more jet set courses than we've had in the past. So you're going to have a lot of
Nice.
options. Yeah.
Yeah, I'll be telling my coworkers more about you
Thank you.
guys. A lot of them didn't understand like how I got the time off and how I'm getting reimbursed and credits for coming to Vietnam.
Mm-hmm.
And so I've been telling a lot more people about the courses.
It's a process, but you
yeah.
know, you got to plan ahead a little bit. You know,
For
obviously
sure,
the
yeah.
airfare really spiked up on this one. So if you
I
didn't plan
know.
early, you didn't get in. So
That's
if you are
true.
going to sign up for one of the courses, get in early.
Right.
And then
Right.
where do you want to go next? If you had a choice.
Well, I mean, I love coming to Asia, so that's always
Just anywhere
come
in
back.
Asia?
I'll come back pretty much anywhere in Asia, but definitely like anywhere stateside too.
All right.
So I'm
well,
in
thank you.
California, so any place around California, Portland's great too, or Seattle.
Where's
would be
your
great.
home base?
San Diego.
San Diego?
Yeah.
Okay.
Yep. So
yeah.
like
well,
anything.
We're going to go there too.
Okay.
So,
Perfect. Yeah.
All right. Well,
Nice.
there you have it.
I'll pull more people in for you.
Thank you.
All right.
Yeah,
Yeah.
that'd be amazing.
Yeah, I look.
Yeah.
I
It's
look
that's
forward
how we
to
operate on
everything.
word of mouth mainly. So this is
Yeah.
great.
Yeah, I think
Yeah.
the more
Just
people
like you.
understand it and hear about it, you'll definitely get more people coming. So
Yeah, you can get so much more out of your content if you get to meet people.
for sure,
You're in
yeah.
a nice place. Your
Yep.
brain learns more when you're relaxed.
Right.
You know,
Yep.
maybe you get a little if you stay after the class, which is our
Yeah.
motto, stay after class.
Right.
Maybe you get a little vacation as
You
well.
get a little
So,
vacation. You guys really have good presenters too,
yeah.
right? Like all of them are just full of knowledge and eager
yeah.
to teach everybody in class.
We're so lucky to know people like Claire and
Yeah,
Michael Shacklock,
exactly.
and Krista Prado, and like many more. You
Yep.
know, so
Yep. Nice.
all right. Any instructors you would like to see in the future? There's two ways you can take a jet set class. One is you
Yeah.
pick a place you want to visit, and then the other one is you pick an instructor you want to have.
No.
So,
Well, I trust you guys. I know you guys are going to get good instructors.
we will never have a bad
I know,
instructor.
I know.
That's our goal, at least. You know.
Yeah, definitely to teach
We've
people.
We're connoisseurs of Con Ed. You know, we make sure everybody's a good lecturer.
You
know?
guys are picky.
Yeah.
Right. And then like every place the couple places I've been to, they're really great places and good hotels, and you guys are like right on the money with everything. So
Thank you very much.
Yeah.
And thank you for taking it.
Yeah.
Thanks for the compliment.
yeah,
All right.
I look forward to more, and good luck to you guys with rolling out 2027 and expanding.
2027 is going to be amazing.
Yeah.
Yeah.
Yep.
All
Nice.
right. And then to you, viewer, thank you for watching this episode.
Yeah.
Thanks for joining us on our happy hour. And
Oh, yeah, happy hour.
Our next one, we're going to be in Tokyo next week. So get ready for that one with Michael Shacklock. We'll be interviewing him as well.
Exciting.
Yeah.
All right.
Thank you
Cool.
very much.
Thank you.
Yeah. All right. That does it. Thank you. Thank you very much.
Jet set in Vietnam, a whole new type. I've been soon satisfied. là the new one fisher just away, just away, just away. Jet set in Vietnam.